For 18 months now, schools in Uganda have been closed and plans to have learners return to class remain unclear. At the end of the first lockdown in May 2020, government opened up the economy, including a partial reopening of schools. However, since the second lockdown was instituted in June this year, schools have remained closed indefinitely. Dr. Freddie Bwanga of Makerere University's College of Health Sciences says closure of schools cannot be sustained for much longer, yet readjustments in interventions like vaccination can provide lasting solutions.
If we are to open schools, the actual risk of severe disease is not with the children, it's with the parents. Supposing we vaccinate them with the little vaccines we have, that will solve the danger of them entering into severe disease, because the science we know today is that the vaccine does not prevent acquiring the virus. As soon as the lockdown is eased, let the children also go back to school. Even if they study for 2 months or 2.5 months, they will have covered something. And if it becomes inevitable for another lockdown to happen, let them come back home.
Dr. Bwanga wants emphasis directed towards providing schools with the required infrastructure to enable the implementation of the standard operating procedures.
Most schools actually have what they call a school nurse. Some have a school doctor. This school nurse can be trained easily to perform this simple test we call the COVID antigen test.
Patrick Kaboyo, an educationist, says the Ministry of Education should by now have audited the sector to establish the key areas that need plugging.
To find out how many teachers have exited, we need to find out how many teachers have been robbed from us by COVID. We need to know how many teachers have been incapacitated because of other social and economic challenges like being at home without work.
The Uganda National Curriculum Development Center has so far presented a compressed curriculum awaiting approval from the Education Ministry before it can be rolled out to schools. However, people like Kaboyo want to see more than documents.
To offer different scenarios. There should be scenario 1, scenario 2, scenario 3, so that we compare and communicate to the parents, but not have those scenarios to be in the boardrooms or to be on very good documents. We need to open up to the public.
We already have a number of teachers and lecturers who are vaccinated that can start phase 1. Then as we go for phase 2, the other ones who are not yet vaccinated will vaccinate. But it is very important that we begin now.
And even the other time you saw the minister here said the students, 900 students in Gulu, for the health course went back to school. So if you can accept over 1,000 plus students go back to school, it means the Minister of Health is confirming that the pandemic, the spread of the pandemic has reduced. So they should open up schools.
As government ponders over the modalities on how to have schools reopen, there is concern out there that the lack of empirical data could be one of the reasons students can't get back to class. The government plan focuses so much on university students, candidates and semi-candidates, leaving out those in pre-primary and lower primary levels. Walter Mwesigye, NTV.